Now we're going to discuss Lab 12, which is part of Exercise 5, Processing Third-Party Claims. This lab teaches the students to process, review, and resolve issues with third-party prescription insurance claims. So at this point, we've gotten our authorization renewals from the physician, or we've sent through a new prescription, and we are now processing them through the insurance company. So the objectives for this lab include to accurately process patient prescriptions with third-party or insurance claims, to understand how pharmacy management software processes third-party claims, to understand why third-party claims are rejected, and learn how to resolve common claim rejections using pharmacy management software. So you're going to read through the introduction and the procedure for this exercise in Lab 12. And managing and processing third-party claims is a complex topic, and it can be difficult to process to teach. With the limitations inherent in developing and teaching with a computer simulation, we can't account for all variables in the scenarios. So it's beneficial to the students that we talk about some things like changes in coverage when planned years end. We have to make sure we get updated information from the patients when their insurance changes over. Sometimes we have certain circumstances that allow for refills or to be filled earlier, things like that, like a vacation request. If a patient loses a prescription, what are the policies on that? Sometimes an over-the-counter medication can actually be covered or not covered depending on the insurance, and how that impacts the way that insurance companies cover things. So, for example, when a medication that previously required a prescription becomes available as an over-the-counter, it may cause one of the other prescription medications, if the patient still requires one that requires a prescription, it may change the tier structure on how that gets paid. So a $5 copay may go to $20 because the insurance company's thinking, well, basically a similar product's available over the counter, they should just be paying for it over the counter. There's also prescription discount cards. There's interactions with Medicaid or other access type assistance measures. So there's different things that can impact the processing on third parties. Now, third party means insurance companies generally, or some kind of secondary authorization. The patient themselves are not paying it. So that's what third party comes into. So let's talk about some key terms. So adjudication is one that we use a lot. It means related to judging or judgment. And it means that the insurance company, that outside position, is making a decision whether that insurance is going to pay for the prescription or not. So capture is a successful submission and obtaining the payment on the insurance claim. When we're processing, we have to have certain information like a BIN, sometimes referred to as BIN, but BIN is a bank identification number, and that has to do with the processing component. And the NDC, you already are aware of NDC numbers. And that's important because some insurance companies have agreements with different manufacturers, so they'll cover one product but not another. So it's important to know when it says that the NDC is not covered. And then relationship codes. So when you're talking about policyholders, you're going to have the person who is the main person on the policy, but they may have additional people on the policy like a spouse or a child, and then there's going to be a code that identifies, is it the card holder or is it a spouse or a child. So insurance companies act as a third party, moving a payment from the first party, the patient, to the second party, the pharmacy. The third party adjudication is also known as third party processing, And it happens when the pharmacy submits an electronic claim to the third party, or basically to the insurance company. The most common reasons for prescription rejections in community pharmacies are that the NDC is not covered, the patient is not covered, or it's an invalid code, or the refill is too soon. Now, that does not mean that those are the only reasons for prescription rejections. Rejection of coverage can cause patient-pharmacy misunderstanding. Pharmacy technicians can become the target of the frustration of the patient, and it's important that we remain calm and empathetic and do our best to try to help the patient. In hospitals, a billing department would normally process the claims. So when we talk about insurance, we want to look at insurance cards. So previously, when you entered some of your patient information, I believe that you looked at insurance information. So here we have Miguel Esparza's. So this is just one sample. And you can look at your textbook for other prescriptions and insurance cards. So we will look through. That will be located towards the back of the procedure component of the text. Let's see, should be coming up in a page or two so that we can get all that information. Okay, so here we go. So here we've got the insurance card and we've got the prescriptions. So you're going to access these to be able to process through. So you're going to log into the Course Navigator. You're going to follow the instructions as laid out in the procedure component of your manual, following through with one from the tutorial. So some of these practice tips, please pay attention, read through those. If more than one plan shows the same name, use the bank identification number on the insurance card for selecting the plan. Not all insurance carriers require the same information. All will have an ID number, but not all will have a group number. They may not have a person code or a relationship number. Note that you have a relationship number on the insurance cards, but not person codes. Keep in mind the person codes are slightly different from relationship numbers. Take extra care on your pharmacy job to ensure that you enter the proper item, person code, or relationship number according to the information listed on the patient's insurance card. So you'll go through the process of processing the insurance claim as laid out in your book. Now, resolving a claim rejection. So if you do all of this processing and then they say, well, no, we're not going to authorize it, you need to inform the patient of the status of their prescription. In case of a rejection, the patients may have helpful information to pass on to you, or they just may become upset. Oftentimes, the reason is they didn't give you updated insurance cards. Keep them fully informed so they aren't waiting. So if it's something that requires maybe a prior authorization from the physician, maybe the paperwork hasn't been completed at that end. Pharmacies do not get prior authorization. That is a prescriber responsibility. However, we can sometimes help and facilitate with information. So we want to make sure that the patient's aware. So when we're going through that, it says to go to the 3 ifs section on step 15. That will take you through. So if not covered, what to do. So 15A, I think that's supposed to be 15B, not 16A. Or no, 16A. I guess they've not just initialed them Bs. So it gives you things like if it's on an on-hold situation, or some of them learn from your previous. I get what they're doing. 15A, 16A, then 15B, 16B. 15C, 16C. So the process is as you're going through them. In the hospital setting, third-party adjudication is dealt with by blank rather than blank. That would be the billing department rather than pharmacy technicians. Which of the following are some of the common replies from an insurance company on a third-party adjudication? That would be NDC not covered, patient not covered, or refilled too soon. So those are some of the things that we'll be looking for. Now, timely delivery of medication and payment depends on the accurate entry of the insurance information. Technicians in community pharmacy devote a lot of their time to resolving insurance problems. We know what kind of messages are coming through. We know what the common cause is, so we want to try to help be part of the solution. It's important to be empathetic with patients who are frustrated with payment issues. We don't know what else is going on, right? Maybe they've had some other issues outside of the pharmacy. So having empathy and doing our best to try to assist them. Double check what you entered. Make sure that you entered all your information correctly and it wasn't an entry code error or something like that. But ask, did you get any new insurance cards recently? Did you change jobs recently? Things like that. Patients don't always think about that stuff. They think, oh yeah, I brought in my insurance card. They don't realize that was 2 years ago. Seems like it was just last month. Pharmacy software will anticipates rejections, is written to accommodate for changes and substitutions. So there are some things in there that will help. Now, going on to some of the new software that we're going to be using with Pioneer RX, we actually will be able to do more realistic type adjudications. So this is just an introduction to processing third-party claims.